If you have a child that's going to need surgery, how could you feed the cow? There's no connection from upstairs to the stomach.
So you try to take care of the children on within a couple of days, and what you try to do is you try to figure out how you're going to undergo this operation. And what that operation would involve either a operation for a tracheoesophageal fistula or an operation for an esophageal atresia. In planning this, you may not be able to feed the child right away, but we always have IVs and we always have what we call nutrition by vein, which can make the child strong. So the operation for a tracheoesophageal fistula would be to go into the right chest, to tie off the connection from the lungs, from the trachea to the esophagus, and then try to put the esophagus together. And with those people, what we'll sometimes do is place a tube in their mouth through the anastomosis. Anastomosis is when you put two pieces of bowel together into the stomach, so that immediately after the operation, a day or so, we can start feeding the stomach with breast milk, which is the best food around for growth of the intestine as well as some immunologic issues. Or we can feed them with regular formula. But what we can do is we can start feeding them right away as the esophagus heals. Then we close up the chest, and then what we end up doing, so we would close, and then we'd wait a week, and we'd test our anastomosis by having the baby drink something. If there are no leaks, then the baby can start a diet. And those types of patients, we want to make sure they don't have reflux, which is the food in the stomach coming up. And we want to make sure that we don't scar, because every time you make an incision anywhere, it's like a cut on your hand. It can scab and scar. So when those things are done, the baby is able to eat. The other problem, that's pure esophageal atresia, where the esophagus doesn't hook up, but there are no other communications. What we need to do is we need to have the two ends of the esophagus grow together. And in the pure esophageal atresia, sometimes they're very far apart. And if that's the case, what we do is we put a feeding tube. That's a little tube. We connect the stomach up to the belly wall. We make a little incision, we hook the two together, and put a tube into the stomach. The baby then, within 24 hours, can start feeding. And over a couple of weeks to months, what we'll do is we'll actually feed the baby, and as the esophagus grows, they'll grow together to the point where a couple months down the line, maybe a month or two, we'll be able then to go back, do the incision in the right chest, find the two ends of the esophagus, and then put it together.